Doctors are not God, so stop criticizing God by telling us one. Hi, myself Dr. Muslima Khan and welcome to Amar Manu. This is my second Untold podcast, a very raw, unfiltered story of mine. Today I'll discuss with you all about heterotopic pregnancy. It's a medical horror if not diagnosed properly on time. So I'll share with you all a story which I have experienced during my post-graduation days. I was a second year postgraduate student at Assam Medical College and I still remember the name of the patient, a very beautiful young lady. Her name was Pahi. I hope you are watching me today, Pahi. She came with a missed abortion and my senior did her DNA and I assisted her. We successfully took out all the product of conception and we discharged her on that day. 2 weeks after that incident, it was Sunday I remember, I got a call from the casualty department telling, hey, your patient is here and she is having hypotension and tachycardia. Please come once and take the call. I called my senior immediately at that time and Ba came running from the hostel and it was just 1 month before her final exams. We ran to the casualty department and saw Pahi lying on a stretcher. When we first looked at her, she looked pale to us. Ba checked her vitals and it was unstable. I called our VS, our guide, and ma'am told us to shift the patient immediately to the emergency room. We have shifted her and by the time we reached to the gynae department, ma'am was already there. That day I have learned one thing, that for a doctor, it's the patient who comes first. It was a Sunday, 1 month before Ba's exam, but she was in the department. It was a Sunday for ma'am. After a whole week, she had kids, she had so many things to do, but she was in the department just for the patient. We took the patient to the ultrasound room. Ma'am and one of our senior, who was also a radiologist, did the ultrasound and it showed hemoperitoneum, that means full of blood in the peritoneal cavity. Ma'am prepared her for emergency exploratory laparotomy. And back in my mind, I was thinking that it might be MTP perforation, which we did 2 weeks back. I think Ba was also thinking the same, that it might be MTP perforation. And ma'am was like, everything will be okay, we'll try to save the patient. And patient party has been explained properly and we took the patient to the OT. When ma'am has opened the abdomen, it was a ruptured ectopic pregnancy. And ma'am was like, hey, etu ki hoi gol? Etu to ultrasound to nasile. But we could save the patient that day. We all could save Pahi that day, but there are so many cases, undiagnosed, struggling, suffering, and recently I found one more such case. As I started my video saying doctors are not God, we are humans, just like you watching me. We are humans, we do make mistakes, but we learn from that. We may sometimes fail to diagnose something, but we learn from that. I have entered medical school in 2013 and since that day I have been learning. I learned from my teachers, my seniors, my friends, my batchmates, my colleagues, my juniors. We learn from our patients every single day. We learn from the sisters, even the ward boy and the ward girls. We learn from the patient attendants. So this is how our life is. We learn, we unlearn, and then again we relearn. This is how it has to be. This is how it is supposed to be. Coming to the conclusion, if your patient has undergone DNA or MTP recently and she is suffering from unbearable pain, you should visit your doctor quickly so that it helps us to diagnose an undiagnosed heterotopic pregnancy. Every pain after MTP might not be a MTP perforation. It can be an undiagnosed heterotopic pregnancy. You never know, because these days these are not uncommon. Share this video as much as you can so that it helps us to diagnose a case. It helps you to save your patient, and stay tuned for more such videos.